Hi, everyone. We're going to be starting soon. We just want to let everyone connect to the audio. Okay, I think we're ready to start. So, bonjour tout le monde. Good morning, everyone. My name is Antoine Bergeon, and I'm the program coordinator here at the Ottawa branch. I'd like to begin by acknowledging that the land on which the National Association of Federal Retirees Ottawa branch office is located is traditional unceded territory of the Algonquin Anishinaabe people. On behalf of the branch, I'm pleased to welcome you to today's webinar titled Let's Talk About the Aging Foot. I want to give a warm welcome to our presenters, Sarab Dormani, registered nurse and foot care specialist, and Dr. Christine Rad, chiropractor and orthotic dispenser, both from the Natural Soul Wellness Center. They'll explore the aging foot, discuss myths versus facts, and provide coping strategies on how to stay strong and healthy on your feet. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. I want to give a special welcome to anyone here who is not yet a member of the association. We hope that these webinars will inspire you to join us. And as to our members, we hope that these webinars will encourage you to maintain your membership. Please note that there will be a question and answer period at the end of the webinar. So if you have any questions for Sarab and Christine, please type them in the Q&A box on Zoom. And then they'll be able to answer them at the end of today's presentation. Okay, that's it for the introduction. So I'll now turn the presentation over to Sarab and Christine. Thank you, everyone.
All right, good morning, everyone. My name is Sarab Dormani. I'm a registered nurse here at Natural Soul Wellness Center, and I'm here this morning with my colleague, Dr. Christine Rad. And it's a pleasure to be here today to talk to you about the aging foot. And thank you all for joining us this morning. So given the amount of stress we place on our feet over a lifetime and all the changes that our body also goes through with the aging process, it's normal to notice certain concerns with our feet. But it's also important to know what is the normal part of the aging process versus what is more of a medical concern, and it should be addressed by your health professional. So today we're going to discuss about the aging foot, some myths and coping strategies on how to stay strong on your feet as we promote healthy aging. So just a quick disclaimer, this presentation is intended for educational purposes only as an overview of the human foot functions, biomechanics, gait, foot health related topics, is not intended to replace any medical advice. And the information shared today are of our knowledge, experience, education, research, and skills. So if you needed advice about a specific medical conditions, we always ask that you speak with your primary healthcare provider or a member of your healthcare team. So just quickly, for those who don't know me, my name is Sarab Dormani, and I've been a registered nurse since 2012. My background is at the emergency department in the ER, and around 2018, 2019, I specialized in lower limb foot care after having a leg injury myself that threw me off of my feet for quite some time. I think it was that little life event that inspired me to specialize in foot care, because at that moment with my own injury, I realized how much your feet are really, really important to your overall wellness, as they are the foundation of your well-being. So that little experience of mine inspired me to co-found Natural Soul Wellness Center, which is our clinic here in Ottawa on Carling Avenue. And at our clinic, we offer different services, but for me specifically, I specialize in foot care. So I offer advanced medical foot care services for everyone. I would say our most popular service is medical pedicures, people coming in to have their feet taken care of, their corns, calluses, toenail trimming, and have basically people that want more of a medical approach rather than a basic approach that you would get at a spa or a salon. I also specialize in compression therapy garments, so I'm able to do fitting appointments for people that are looking for compression socks. We also offer footwear assessments and custom orthotic appointments at our clinic with gait scan analysis with my colleague, Dr. Rad. We also offer other services to help people with chronic pain management, such as acupuncture, massage therapy, reflexology, laser therapy for pain. And most of our services can be covered under private insurance care plans.
Alrighty. Good morning, everybody. I'm Dr. Christine Rad. I'm a chiropractor here in Ottawa, working at Natural Soul Wellness, where I do a lot of gait analysis and orthotic dispensing for those who particularly need them. As a chiropractor, I went to school in Toronto, and then as well as the University of Toronto in kinesiology. But that's all sort of coming back to Sarab's little point about how one life event sort of brought you to the path that you're on now. I suffered a fractured ankle when I was young and playing sports and things like that. It's quite incredible to know how difficult life can get when you don't have access to a functioning foot. And so when it comes to these things, I think it really steered me in the direction of helping people keep moving, right? So helping people keep moving, whether it's with arthritis or low back pain or foot pain or any sort of movement dysfunction. I've taken so many different courses just to, one, build my knowledge base, and then helping patients, because the more I know, the more knowledge I can impart on my patients. So a couple things listed here, but there's definitely more in the background that I've been doing in self-learning. But since I've been doing a lot more gait analysis and foot related treatments, the lower limb has really taken a hold of me, and it's really fascinating to learn about, to think about, and to really consider when it comes to overall health, because it, as Sarab mentioned, it really is the foundation for you. So yeah, and I also work with the Ottawa Hospital, sort of subcontracted out as for people with low back pain. So there's a lot of different opportunities for people to access care that potentially they might not be able to. So always just speak to someone and see what sort of information you can get from people, because there are resources out there, such as ourselves. Alrighty, so the aging foot, there's a lot to consider just because the foot involves a whole bunch of different bodily systems. We have things like fat pad atrophy. So the nice cushioning that you have on the sole of your foot, that actually tends to decrease as you get older. We have things like neuropathy. So when there's issues with your nerves and the signals that they're giving back to your spinal cord and brain, that can definitely impact how our feet function, how we're able to get about our environment. As many people often have heard the term gout, which is basically high uric acid, which tends to actually influence the joint in terms of pain and function, which can be quite limiting, because I know a few people who have gout and it comes in cycles oftentimes and can be triggered by a lot of dietary things and lifestyle factors. So if you ever experience gout, talk to someone about that. There are some ways to manage it, at least in the short term and long term. Things like your skin health itself will also deteriorate. So we get more dryness and cracking of the skin, which again can influence things, which Sarab will go into a little bit more detail later, as well as thicker toenails, right? We have obviously different changes that are happening throughout the foot. Osteoarthritis, which is probably the big thing that I see a lot of, is basically inflammation in the joint just due to normal degenerative changes. And we'll go over as to what normal is when it comes to arthritis and what is not. And so, yeah, a big proponent of that one is inflammation. So ways to manage inflammation is going to be a big one. And then we have bone deformities, which can sort of tie into osteoarthritis, where we notice like our toes get larger, they get deformed, they change shape. So if you've ever heard of like claw or hammer toes, or things like bunions, those are very common as we get older. And we'll talk a little bit about those. And then we have things like circulatory problems, which most people often, if they don't experience it themselves, and they definitely know someone who has, where we're thinking about any sort of varicose veins or spider veins, swelling in the legs, whether it's edema or just, regular swelling. Lots of different things that can be happening. They're very common, but they're not normal, right? And that's exactly what we want to sort of tease out in today's session is common things are not always normal.
Great. So before we talk a bit more about in details about the concerns we just saw about the aging foot, I did wanted to share some of the myths that I hear in my practice quite often. So one of the things I often hear in my practice when patients are coming in, when they have foot pain and we discuss about it and we try to like see, well, what's causing the foot pain and some of the solutions that are out there. And often people are like, well, foot pain is normal. It's part of old age. So myth number one. Number two, I often hear people saying that they've been like a size 9 their entire life for their shoes. So they try to still fit into the same footwear that they wore maybe 15, 20 years ago. People thinking that maybe their foot sizes doesn't change as they age. And then another myth that I hear often is if they have swelling in the legs, and I try to address this concern, then they say, well, I was told that it's part of aging, and the stiffness in their feet, it's all normal. And the fact that they're less mobile with that, it's all part of the aging process. So basically, oh, sorry, I'll just get you to change the slide. Thanks. So basically, I'm here to say that, yes, these are all myths, but no, they are not. These are not all normal part of the aging process. So first of all, foot pain is not normal. And pain should never be considered as part of the aging process. So when you do have a foot concern or a pain, it's important to diagnose the condition and manage it rather than just brushing it off. Unless you have really a specific diagnosis, you shouldn't be walking and feeling pain. You want to properly manage your pain to help you keep moving and staying active, because most pains are preventable and manageable. So we're going to talk about arthritis a bit later with Christine, but it is normal to feel some discomfort with arthritis, but there are still things that we can do to help manage the condition, to help keep you more active and mobile. Myth number two, so thinking that you can still wear the same shoe size for 10, 15 years, definitely not true, because your foot size does change as you age. So what happens with your foot size and shape is that your body's ligaments and tendons, they lose their strength and their flexibility with the aging process. So with that, you will notice that the arch of your foot is going to drop down a bit. So if you feel like your feet are getting flatter, it is actually normal to notice that. So when your arch falls, it does flatten the foot bit. So it does make your foot become longer and wider. And so you are going to notice that your shoe size is going to increase, maybe by half a size to a full size. And then you are going to also notice that your foot is getting wider. So it is important to consider wide width footwear. I would say 95% of my patients at the clinic, I fit them in a wide width. If there's definitely more room, less constriction, a lot more comfortable, and it just fits patients better without necessarily causing an injury to their feet. Definitely conditions such as bunions and hammer toes, you would want to consider a wider footwear, but also a shoe that allows you to have a bit more depth. Because if you have a hammer toe, your toes are kind of like sticking a bit more up in the air, and you don't want the top of the shoe to start rubbing on the joints and on the bones on the top. So with that being said, if you haven't had your feet measured in quite some time and you're out there wanting to look for a new pair of shoes, it's not bad to just take a minute, have someone at the store to help you out to measure your feet and to make sure that you are shopping for the right fitted shoe to your size, rather than thinking that, oh, I've been a size 9 my entire life, I'm just going to try to fit my feet into a size 9. And then myth number 3, thinking that swelling, joint stiffness, and decreased mobility are the normal part of aging. They are not. These are all conditions that definitely need to be assessed by a health professional. So when you do have leg swelling, you want to know what is causing the leg swelling. Is it the veins? Are you having poor venous return back to the heart? So where the blood is having a hard time flowing from the legs back to the heart? Is it the arteries that could have maybe some potential blockages? Is it the lymphatic system that is not draining properly? Is it something that's affecting your heart and your kidneys? Are there certain changes that you can make, such as you know, having a diet with a lower salt intake or having a bit more fluid restriction? Would you benefit from compression socks, or should you see your family doctor for medication for fluid restriction, fluid retention, sorry. So it's important to find the cause, because having legs that are swollen will affect your footwear choices. Okay, so you can't really fit into maybe a regular shoe that you would be wearing because of the swelling is taking some room. But also it does affect your mobility and your gait, because swollen legs are a lot more heavier. So it's just more difficult to be able to walk as freely. When it comes to joint stiffness, again, it's important to investigate, is it possibly osteoarthritis or maybe another kind of arthritis, because joint stiffness in the feet can also affect your gait, your balance, your coordination. Again, is there anything that we can do to help out, such as different exercises or different stretches to improve your foot flexibility, to help reduce pain and inflammation? Can we strengthen the muscles and increase your range of motions in your feet, and ultimately also promote strong and healthy bones and joints? So the goal is that we want you to stay healthy on your feet. We want you to stay active, mobile, and independent, and just to know that many of these conditions can be either preventable, manageable, but not necessarily try to brush it off and say that it's part of the aging process, and it is what it is. Next slide.
All right. So one of the big things that most of us start to feel as we get older is that feeling that we don't have that same stability in our feet. So I'll kind of open it up with just like a little thought question. You don't have to answer anything like that. But when was the last time you stood on one leg for longer than 2 or 3 seconds? And I mean comfortably stood on one leg. Most of us, the body is in balance. A body in balance relies on itself, meaning that it has to have the know-how and tools to maintain its equilibrium. When the systems fail, we often get accidents, right? So falls in elderly populations are very serious concern, as they are potentially life-threatening. And so risk factors to falls that we always want to be kind of thinking about is that we have a history of falls is definitely going to be a risk factor. If it's happened before, it might happen again. Impairment to your balance, that could be a spell of vertigo. That could be low blood pressure from a laying down position too quickly or and trying to stand. Particularly reduced muscle strength. So increased risk of falls due to reduced muscle mass there's a term that we use in the medical field called sarcopenia, and that is age-related decrease in muscle mass, right? As we all sort of experience that, it does actually start as early as your 30s and your 40s. That doesn't mean that you can't gain it back. It's a lot harder and it's a slower process, but we can certainly gain back muscle mass. And with muscle mass comes movement control. And so the other thing to also consider when it comes to risk for falls is visual problems. So having your eyes checked, and then having multiple medications. So polypharmacy, if you have more than 4 medications, those often come with side effects, right? And some of those side effects can be dizzy spells or feelings of vertigo, or even just kind of the unsteadiness that you feel on your feet. Having difficulty with walking on its own, like outside of any sort of other condition, but just having difficulty with walking. Functional limits and increasing age over 65. Those are all risk factors for falls. As we get older, the other issue that we also run into, which is again a risk factor when it comes to falls and what can actually prolong that recovery process, is our bone density. And that if we reduce our bone density, that increases our fracture risk. And then also having other conditions that typically come on later in life that will influence things, right? So having other comorbidities, diabetes, kidney issues, whether it's actually vertigo itself, right? All these other comorbidities will influence how the body is functioning. So we can't necessarily think that one system works completely on its own. They're all interrelated. And the one thing that I always mention to people is that a body needs to actually be exposed to something for it to actually learn how to manage that, right? So if we're never truly testing our balance, there's no way that our body is going to get better at balance. We just don't work that way. And so we have to expose ourselves to that, controlled environment of testing our balance. But that can come with physical activity. That can come with, one-to-one training with someone. There's a lot of different ways that we can do it. But physical activity levels as people get older, whether it's a causal relationship or not, but physical activities tend to drastically decrease as we get older. And even more scarce than just physical activity is actually a genuine strengthening program, right? So genuinely strengthening the lower limbs to maintain that muscle mass. It's one of the things that I start off first with my patients is just getting them comfortable with, trusting their body again. And so we want to maintain that muscle mass and bone density. The other thing to consider is things like foot deformities. So those could be things like bunions, claw toes, hammer toes, heel spurs, a lot of other things that can come along with it. But basically, our anatomy determines the function. So the bones and joints of our feet have a particular anatomy to achieve a particular function. We have many joints that allow for a lot of movement, but with this freedom of movement in our feet brings with it the responsibility to train and control that movement. It's the same with our hands and it's the same with our feet. If the anatomy of the foot changes, then so does its function, right? You can imagine that a foot that has bunions might not have the same stability side to side as it would if maybe the toe was facing straight ahead, right? Just because it's a wider base of support. So bunions reduce sort of the propulsive capacity of the foot, and it shortens the plantar fascia, which I'll go over in a little bit. Plantar fascia just sort of sits in the bottom of your feet. A lot of people often develop pain with it, but it is part of that propulsive mechanism that allows the energy that our body produces to propel us forward. So a tightening of the intrinsic foot muscles can also affect the internal structure and function of the foot. Claw and hammer toes are a very clear sign of an altered foot function and reduced strength capacity, because you just don't have that same control or movement variability that a normal toe that's moving freely will allow. Orthotics can help orthotics can help normalize foot function and provide cushion support in areas that may be functioning suboptimally. But that doesn't mean we can't change things. There are some, like I've worked with some people on their hammer toes and they've gotten a lot better in terms of their function. Some hammer toes are sort of stuck in their way. They've stiffened up to the point where they're not modifiable anymore, but we can still improve foot function when it comes to therapy and strengthening and exercises. But a contracted toe, like a hammer toe or a claw toe, cannot produce the appropriate amount of stability to maintain a foot and ankle strategy that maintains our balance. And so joint deformities also alter the feedback mechanism that we have when it comes to knowing where our body is in space. And this comes back to that altered balance or reduced balance sense. Our joint position sense and what the brain tells our brain that our balance is off, those become compromised. And we can see how the cascade sort of keeps flowing in that sort of negative direction. So pain and reduced function often come hand in hand. But when we have pain, we alter our body movements to accommodate those symptoms. And oftentimes those strategies are not necessarily optimal for long-term functioning. And so we always want to consider things as a whole and assess the person as a whole instead of just looking at the bunion or just looking at the claw toe. And then coming on with deformities, we have joint pain and arthritis. Joints evolved to allow movement, right? They allow different movement to happen between segments. When movement's compromised, the living components degrade, right? We're biological beings, which means that we need to keep the system healthy for it to maintain its health. Joint degeneration, which is often used synonymously with arthritis, is part of the normal aging process. As biological beings, we get older, but that doesn't necessitate that we're supposed to be in pain, or else every single person over the age of 65, for example, would be in dire pain just because they have arthritis. And that's not the case. We know a lot of people who are completely pain-free, even though they do have arthritis. So something to keep in mind that arthritis and pain do often come hand in hand, but they're not necessarily always supposed to happen together. So our feet are part of a kind of like a movement chain, as I like to say. So they're part of the entire lower limb. The function of the foot is influenced by and influences the entire chain when it comes to movements. So it's common to have hip and knee arthritis that changes the way we walk, because when we're walking, we're weight bearing, and that's increased loads that potentially maybe that joint is not happy with, or is giving you symptoms like stiffness or pain or muscle tightness or anything like that. So people, when we have arthritis, what often I see in clinic is that people often use shorter steps. They shuffle, they limp, they lean their torso to one side or the other. They often use walking aids, and they'll use that particular limb less, right? But as we know, for human function, you actually have to use that limb for it to maintain its function. And so the hallmark signs of arthritis are pain at rest or with movement. Joint stiffness, swelling, redness, and deformity oftentimes can happen depending on why the arthritis is there. And then particularly in the absence of another condition such as gout and joint trauma, right? So arthritis is sort of, we always consider other things first, rule those out, and then, okay, it's probably just arthritis that we're managing. But other conditions such as gout, it is technically an arthritic condition, but it's not the typical osteoarthritis that most people consider to be part of aging. Gout is not normal, it's just common. So it is something that can be metabolically managed. And there are other conditions that affect the joints systemically, right? So if anyone ever had any other conditions such as diabetes, it will affect your joint health, it will affect your nerve health, right? And we need nerves to function for our joints to function. And same thing with our muscles. So all these systems play into one another, and always consider them all inclusive. And that's why we always ask patients about their past medical history, because we need to know these things if we're going to treat you appropriately. And then the last thing I'll kind of talk about here is plantar fasciitis, which most people have heard of it, but plantar fasciopathy, same idea. It's just sometimes there actually isn't any inflammation actually happening. And so the fasciopathy just sort of refers to the fact that there is a pathology happening with the plantar surface of your foot. And you can see in the diagram there that it is that white sort of connective tissue on the bottom of the foot. It's not a muscle itself. It doesn't contract, but it does help with that propulsive aspect when we're thinking about foot function. When people have issues with their plantar fascia, they often get a sharp, burning, stabbing pain in the bottom of their heel or their foot with walking and weight bearing. And this is particularly worse first thing in the morning. And what I often will tell people is that pain that sometimes wakes you up in the early AM or is worse first thing in the morning, it's most likely because it has some sort of inflammatory component to it, meaning that inflammation is actually the most active at night. And so that's always something to consider, because that's when the body is healing, right? It's comparing and using all the information while we're sleeping to repair the body. And so that's oftentimes where the inflammation is actually the most active and tends to actually slow down during the day. Plantar fasciitis or plantar fasciopathy is kind of the most common in middle age, so between 40 and 60 years old. And it actually is more common in women. We don't actually know the reason why, but it is more common in women. And some predisposing factors. Now, they are predisposing factors. They're not necessarily direct causal relationships. We just tend to see these more commonly. Is flat feet or higher arched feet. So it could go in either direction. Limited ankle bending. So like tight muscles in the back of your calf or in the bottom of your foot. If you're overweight or obese, it's just more pressure down on the bottom of the foot. Same thing with the joints, right? Being overweight can affect just the amount of pressure that's being put through the joints. Things, if you have a job or a particular, location that requires a lot of standing for long periods of time, that can also influence plantar fascia pain, as well as heel spurs. So heel spurs are basically a little bony outgrowth that happen at the bottom of the heel where the plantar is actually attaching. So kind of right in here. Those can be focally very sore and often do really well with just like a orthotic that has a cushion for the heel itself or a hole cut out for that heel spur, specifically because it's just a bone that's not supposed to be there. So it's like having a pebble in your shoe. It's not supposed to be there. It hurts every time you take a step, but there are ways to manage it. And when it comes to plantar fasciitis, so approximately 50% of patients with this condition will have heel spurs, but heel spurs are not necessarily the cause. They can be very painful, and there is like a bone coming off the heel, and it's not meant to be there. Yeah, I think that's pretty much all I wanted to say regarding that.
All right, thank you, Christine. I'm actually getting some comments that maybe my video on my side is a bit choppy and that my voice has been freezing a bit. So I'm just going to stop my video, but you'll still hear me, just so we'll see if the connection helps out a bit. All right, so sorry about that. Technical issues, but we'll manage. So I just wanted to talk about some common skin changes that we do see with the aging process, and that can also affect your feet. So definitely something that I see very often in my practice are patients coming in with dry skin and dry skin leading to itchiness. So not necessarily eczema or psoriasis, but just like that itchy feeling from dry skin. Cracked heels, calluses, corns, although not specific to the aging process, but does increase, the incidence does increase with the aging. Sensitive skin, broken blood vessels, and age spots. So what happens to your skin as we age is we will notice that the skin is going to become thinner, mostly because there is a reduction in the cell turnover. So the production of new cells is slowed down. So that's regeneration. Typically, your cells regenerate every 28 days, but then it takes a bit longer with older adults. Another thing that we also notice is the very important proteins in our skin, such as collagen and elastin, their production also reduces. Believe it or not, the production of collagen reduces by about 2% after the age of 25, so by 2% every year after the age of 25. Collagen is a protein that helps with your skin's strength, and elastin is a protein that helps with your skin's elasticity and that rebound effect, so that stretchiness. So we kind of like lose a bit those characteristics in our skin. With that being said, something else that we also notice is the loss of fat pad under the skin. So that definitely does affect our feet because we do have natural fat padding cushioning under the foot. And when you have sort of a loss of that or an atrophy of the fat pad, the bones in your feet are just a bit more exposed. So when you are walking, sometimes you really feel like you're walking on the bones of your feet because you don't have that natural cushioning. And with certain stressors like friction, oh, just come back. We switched too fast.
Sorry, I don't know how
I'm not done. No, it's okay. So with certain conditions, certain stressors on your feet, such as friction and pressure, and with that loss of natural fatty tissue under the skin, you're just going to be more prone of developing conditions such as corns and calluses. Something else that also happens is there is a diminish of sweat gland productions and natural oil production in our skin. So that can make us more prone to skin dryness and eventually leading to cracked skin and cracked heels. Certain medication also can increase your risk of having dry skin, such as diuretics, just because they help with water retention. So they kind of like remove that excess water into your body, but that can also lead for your skin to just feel a bit more dry. I definitely wanted to talk a bit about age spots and sun exposure because not a lot of us think about applying sunscreen to our feet and our legs, but nonetheless, our feet and our legs are exposed to the sun and to harmful UV rays, which can increase the risk of certain pigmentations on our feet and our legs. And if you do notice any spots that are just not normal, any lesions that are growing, those are things that you want to have addressed by a family doctor because you definitely want to rule out any risk of cancer happening on the on your skin. And that's something that I've noticed in my practice, patients coming in and being like, what is this? And I'm like, this does not look good. They go to their family doctor and they're diagnosed with skin cancer. But if we can, catch it early on, then we can address it with better outcomes. So with the thinning of the skin, we also notice that there is a thinning of blood vessels as well, such as your veins under your skin. with that loss of elastin. So your veins just have less of that elasticity to them. So there is more of an increase of broken blood vessels and bruising as well. There are also other conditions that can lead to bruising, such as if you're on blood thinners or if you have any liver conditions. You also want to be a bit more careful with vein disorders because it can lead to potentially developing sores and ulcers, such as vein ulcers under the skin. And then that's something definitely that we see more in the aging population. So with skin cracks, you have to tell yourself that anytime that the skin is broken, because your skin is your largest organ on your body, it is a barrier that protects you from all of the pathogens in the outside world. When the skin is broken, there's a sore, it does increase the risk of an infection developing. So you want to be cautious with that. And then next slide. So something else that we also notice are nail changes. So there are conditions such as thick toenails, painful toenails, infections to the toenails or trauma to the nails that can definitely, cause some aches and pains to our feet. What happens is that our nail growth slows down as we age because there's a decline of estrogen and testosterone production. And estrogen and testosterone production help with the production of keratin, which is a protein that is found in our skin and our nails and our hair. And with that slowing down, our toenails become more thick, more brittle. They can crack very easily. They can become yellow and just kind of lose a bit of their clearance. And it can be challenging to trim and file or even reach and properly trim your toenails when they are thick and brittle. So the other thing also is your nails, they grow in waves. So they don't just grow straight out. So with their slow growth, what happens is that all of the little keratin cells, they kind of stack up on top of each other. And then so that's why your nails are often going to look thicker rather than longer. Nail thickness can definitely add pressure to the skin. And I've often, while trimming patients' toenails, had a few cases where, we were trimming the toenails and all of a sudden noticed a wound or an ulcer under the nail plate. So this was mainly from excessive pressure. And then that can definitely lead to an ingrown toenail that can potentially become infected. When your toenails, they crack and they're more brittle, there is also a risk of other microorganism penetrating the skin, such as fungal infections. So you can be more at risk of developing fungal infections. It also depends what your feet have been through. So if you've been wearing tight shoes your entire life, or if you are a runner and you've been running marathons for 20 years, then that can also increase the risk of developing thicker toenails just because your nails have been under a lot of stress. There are also certain medications that can change the appearance of your nails. Certain conditions such as thyroid conditions, if your kidneys are affected, if you have lower blood supply into your legs, then that can also affect the growth of your nails. But nonetheless, any conditions that you have with your nails that are causing discomfort or pain, or if you're wondering if it is an infection, then that is something that needs to be addressed by a professional. Next slide. So I also wanted to quickly talk about neuropathy. There is a lot to say about neuropathy, and I think there's still a lot that we are learning about neuropathy. Anything that affects like nerves and neurological is, it's such a mysterious world out there when it comes to our nerves. But ultimately, neuropathy, with peripheral neuropathy in the feet specifically, there is a loss of sensation and possible nerve damage. So symptoms that are often reported by patients are burning sensation, tingling, pins and needle sensation, and numbness to the feet. There are different types of neuropathy. So motor neuropathy is when the nerves that control the muscles and the movements are affected. With that being said, it can lead to muscle weakness. And so patients with a motor neuropathy in their feet and their legs are going to have more of a dropped foot. When they're going to be walking, they're going to be like dragging the foot rather than like lifting it during the gait cycle. There's also a sensory neuropathy, and I would say that's the one I commonly see in my practice. So there is a diminished sensation to pain, temperature changes, and touch. And that's the one that we're concerned with the loss of sensation, because ultimately, if you are stepping on something, or if you have a foreign object in your footwear or on the ground and you don't feel it, it does increase your risk of injury and possibly causing a sore. And then if you're not able to reach or see under your feet, and if that sore is left untreated, it can lead to infections. And then there's also autonomic neuropathy, which autonomic basically means body functions that we can't control. And when it comes to the feet, it's mostly your natural skin hydration. So producing sweat from the sweat glands and natural oils being released to keep your skin hydrated. So if there is that part of the neuropathy, that can affect your skin health, then you're also more prone to having more dry, cracked skin. There's not any specific cure for neuropathy. I haven't seen it in my practice. I mean, there are, certain gimmicks out there. It's really, really hard to reverse nerve damage, but we can definitely manage neuropathy and help managing the symptoms of neuropathy and ultimately looking what is causing neuropathy. And so we can prevent any further damage to the nerves. So one of the biggest causes of neuropathy in North America is diabetes specifically. So nerve damage happening because of blood sugar levels not being controlled very well. There are also other causes to neuropathy, such as patients that have undergone chemotherapy, strokes, and certain surgeries. I've noticed patients with knee pain complaining about neuropathy, and it does make sense because with surgeries, you're ultimately having, your blood vessels and your nerves being cut through. So it is normal to feel that. In clinic, what we do is a very, very simple screening test of your feet with a monofilament. So we kind of do a little poking test, we call it, to see if there are any nerve damages or not to your feet. And then next slide. And then while we can talk about other conditions that we do notice with the aging foot, ultimately, not all aging feet are the same. It definitely does vary from person to person. But there are other conditions too that can contribute, such as edema and swelling of the feet, like we talked about earlier. So see what is causing the swelling into your feet and how it can be addressed with your team of healthcare professionals. Peripheral arterial disease is another one. So basically, it's similar to blockages in the arteries around the heart, but same thing is happening into your feet. So that is something that's usually diagnosed with a ultrasound to see if there is any, plaque or buildup or cholesterol buildup in the arteries in your legs. Varicose veins, so your veins start lose elasticity, the blood in the legs is having a harder time flowing back up to the rest of the body, and then we want to just basically prevent complications such as venous ulcers or blood clots happening into the legs. Type 2 diabetes is something that we are noticing more and more, and it is an ongoing pandemic. Diabetes numbers are not on the low, they are on the rise. And with that being said, there are complications related with type 2 diabetes, such as, from neuropathy and having an infection, from an ulcer that can potentially lead to a foot amputation. So if the numbers of diabetes are on the rise, and the numbers of foot complications and potential foot amputations related to that are also unfortunately on the rise. There are other conditions that we notice. So, as we age, for some of us, it can be more challenging to reach our feet. I always say that the human body was not made to take care of its own feet. I see it every day in my practice. I also struggle taking care of my own feet. So with the reduced flexibility, it is harder to reach and see your own feet. So therefore, their care can unfortunately be neglected, especially if we don't know where to go to receive proper medical foot care. And also other chronic pains such as heel pain, metatarsalgia, Morton's neuroma, or other neurological pains, and specific history of traumas, injuries, fractures that your feet might have been through, or surgeries that you may have had. All right, that's it for me, Christine, for this part.
All righty. So why you should take care of your feet. So regular foot care is important at any age. Taking care of your feet should be sort of considered the same as taking care of any other part of your body, your mind, your physical body. And so at any age, what we want to really highlight here is that you should be able to adapt your foot care to the age-related issues. When you're younger and there are different concerns there, you're addressing them appropriately. As we get older, different things start to come up, and we want to make sure that the treatment matches the person. And so when we're thinking about taking care of your feet, what we want to kind of highlight is that proactive and preventative approach versus reacting to something that happens to us. So being proactive, as you probably heard in the past, when it comes to healthcare, being proactive about your health is typically a lot easier to manage. And foot-related issues, we have those dollar signs there, but it's not necessarily that it's just the financial cost of taking care of your feet when things go wrong. But it could be physical. It could be your ability to do things with your family or your grandkids. It could be social or psychological, right? So it is a cost that we have. Everybody's cost is going to be a little bit different, but it is a cost nonetheless. And so I always ask questions kind of open-endedly. They're not necessarily answers that I necessarily need to hear, but something to think about is how many times have you potentially avoided participating in some life event because of your foot health or because of health in general, right? So our main goal is to keep you active in life, right? Independent, being able to care for yourself, and helping you and giving you the right appropriate advice for that time in your life. And so just making sure that the treatment matches the person. And then considering the amount, so a little analogy to that is consider the amount of effort it takes to potentially maybe write a little, 5-question quiz. There's really not that much stake in that quiz. You don't have to prep very hard because quizzes tend to be a little bit easier. But then compare that to, that end of year final exam where you're now consolidating all that information that you learned over the past year, or an injury that has potentially been there for several years, or a condition that's been altering your health. It just takes a lot more time and sacrifice in terms of things towards your recovery, right? So we always want to make sure that we're trying to prevent these things from coming on, solving the little problems first before they become larger problems that take longer to heal. And then the other thing is quality of life, right? We should be taking care of our quality of life, and that sort of comes hand in hand with staying active and mobile, right? Our feet will treat us well if we treat them well. So making sure that they're strong, making sure that they're clean and hygienic, making sure that you're giving them the right appropriate treatments, whether it's moisturization or proper cleansing, or strengthening for the feet. It all comes back to, making sure that the individual is healthy. So that could be pain management, that could be fall prevention, so balance and walking exercises that you can do with a personal trainer. We do know some in the community who can help you with that. And then the hygiene component, thinking in terms of like preventing sores or new injuries from getting worse, infections and other diseases. We always want to make sure that we're preventing the big things from coming on. Okay, so it's those little things that we do on a daily basis that really compound and give us those long-term results. And so we really just want to focus on those things because the little things are easy, right? And they just take a little bit of more time and effort kind of to get started, to get that momentum going, but they do tend to stick a lot longer for us. And where we kind of mentioned there, the right products for you. Finding the right products for you specifically highlights the common trend that a lot of people will buy something on Amazon because they've heard something about it, or potentially maybe we just got influenced really well by their marketing tactics. But it doesn't, just because you saw it or there's a lot of 5-star reviews, doesn't mean that it's necessarily the product that's appropriate for you and where you are in your stage of life. And so that's where we always sort of highlight is go see a professional, let them give you that one-to-one sort of approach, because one size fits all, as we sort of know based on our life experiences, one size fits all never fits anyone. And so that's the same thing with healthcare advice, is that we should always consider ourselves and a tailored approach to that. So it's all about finding the right treatment at the right time for the right individual, right? And that's where that one-to-one approach with a healthcare provider or team really helps you kind of move you in the right direction, because they're going to be focused just on you and not marketing. So that's one of the big things that we wanted to highlight here. And then when we're thinking about self-care, it's been a bit of a trigger word for a lot of us in the last few years. Self-care is taking care of yourself first so that we can show up better for those around us in our community. So things to kind of keep in mind if you want to just have those take-home messages from today. Daily foot checks. So taking a look at the bottom of your feet. If you can't get there, have someone else to take a look. There's always it's again, trying to catch something early and taking care of it as we need. Maintaining your physical activity levels to your abilities, right? There's always a graded stepwise progression to physical activity. It's not 0 to 100. And that's where having a qualified professional really just guide you through those movements is going to be very valuable. Considering orthotic use when it's appropriate and when the individual is a good candidate for it, as well as quality footwear. So always making sure that you're taking the time to find the footwear that fits your foot and not the other way around. And we do have tips and tricks on how to do that. And so we're always happy to chat with you one-to-one. And then finally, getting assessed by qualified medical professionals. So whether that's with myself or Sarab or anyone at the clinic, we're more than happy to, give you our assessment and our 2 cents on what's exactly going on and what we think you best manage with. And then just always maintaining that, hygiene routine. The same way we maintain our oral hygiene, we want to maintain our foot care hygiene. Anything you'd like to add, Sarab?
No, I'll kind of add on to the next slide. All good tips. I approve. So there's definitely a lot you can do at home to take care of your own feet, but nonetheless, there's always a team of foot care professionals out there in your community that can help you out. So if you do need help with your foot care trimming, your toenail trimming, your foot care, those are reasons to see a foot care specialist rather than trying to attempt it yourself. If you're not able to reach or you can't see your feet very well, the last thing you want to do is to cause an injury or a potential trauma that can lead to an infection. Diabetes is a condition that we like seeing in the clinic. There is a lot of prevention we can do with diabetic foot care, and then have it well managed also at the clinic, just to make sure that diabetics are informed about everything they can do to keep their feet healthy, and to know that foot care specialists are a very important member of their healthcare team. With pain management, it is important to see a professional, because it's important to see what is causing the pain and how we can address it to just make sure that you are just going on comfortably with your daily activities. If you do have circulation problems in your legs, it's important to see, well, which channel in the leg sort of is not functioning well. Is it the veins? Is it the arteries? Is it the lymphatic system? There are ways to communicate that we can communicate with your family doctor and maybe have them prescribe some testing for you if it's some ultrasounds. Just to get a better diagnosis and to make sure what we can do to treat it. So is it something because there's just too much fluids in your body, or is it something that would benefit from compression garments? So those are all things that we can detailedly look with patients. If you have questions about footwear and orthotics, it's important to have your feet properly measured to wear a shoe that is fitted and comfortable for you. But also, it's important to also have a shoe that also supports your feet. So if you are losing some fat pad in certain areas of the feet, then maybe having a custom orthotic specific to your feet can definitely help elevate some pressures in those areas. Ingrown toenails is definitely something that should be handled by a professional. It's not the time to, open up YouTube and start looking about how you can treat your ingrown toenails yourselves. These self-care ingrown toenail bathroom surgeries, they never end up very well, and they always end up in the clinic with an infection, and just it gets a bit complicated. So just have that addressed by a professional. If you have a toenail infection, that's also something that needs to be addressed as well, because nail infections, they don't go away on their own. They definitely do need treatment, but then there are different treatment options that we can review with you as well. Any skin care concerns. So if you have cracked heels, corns, or calluses, I don't often like the different over-the-counter corn pads or callus pads that are sold at some of the pharmacies, because they have high contents of salicylic acid, which can just also burn all of your healthy skin. So it's important to have that addressed initially rather than try to treat it yourselves, because the last thing you want to do is to break your skin barrier even more. And then why not just drop in for an annual foot exam or foot check, just to make sure everything is well. And then I would say most people, they definitely come in to see a foot care specialist just because they want more than a nail spa approach, a basic approach. They just want to be make sure that they're properly assessed and they have a treatment care plan that is addressing their needs. So as we mentioned many times, your feet are the foundation of your body, and it's important to take care of them. So just like your eyes, your ears, your teeth, your feet should also be part of your routine checkups. And the whole point of all of this is that we want you to stay active, independent, and engaged in your daily activities and to promote healthy aging. All right. Well, thank you everyone for joining us, both me and Dr. Rath this morning. We have a few little short minutes for some Q&As. I think the presentation, there was a lot of materials that we were going through, so it was very enriching, and hopefully you learned a lot from today's presentation.
Thank you. Thank you to both. And yet we have a few minutes. So I'll go over some quick questions. Do you have any thoughts on toe spacers?
I can answer that one. Yeah, same here. I love them, and well, we love them. But I think it's important to find the toe spacer that is appropriate for your feet, because there are different sizes. There's also different sort of width of toe spacers, so you're not going to use the same spacers as you would for the little toes as you would for, between the second and the big toe either. So I think it's important to have your toe spacer fitted to your feet.
Okay. This next question, how often do we have to change our orthotics or have them assessed for comfort?
I guess maybe I'll take that one. Orthotics themselves, consider them kind of like shoes. It really depends on how often you're actually using them. Some people use them in one pair of shoes that maybe they go out walking in. Some people are wearing them throughout the day. It really just depends on the wear and tear of the orthotic, and also the materials that they're made out of. The best person to ask would either be someone like myself, so I can take a look at them to see what they look like, as well as just, I usually tell people 2, maybe 3 years is probably going to be the max. I've had people coming in saying they're wearing the same orthotics for 15 years. Not going to be a good orthotic for you, just because your foot changes, as Sarab was mentioning in her previous slides, is that our feet change as we age. And they change based on what we're doing in our lives, right? So having kind of like an up-to-date orthotic is always going to be best. But before we even go down the route of buying a new orthotic, like get an assessment done, get the gait analysis, kind of like the image that we have here with our pressure platform and the computer diagram that we have. It will be a lot more valuable to find out, do you actually still need orthotics? What should the orthotic be correcting or helping with? So it really just depends on the person and what their orthotic shape is.
Okay, perfect. This person asks, can statins cause peripheral neuropathy in the foot?
I've read mixed studies about it. I think it also depends who's always paying for the study or sponsoring the study. So it's often hard when it comes to pharmaceuticals, and I'll just leave it to that. It's
Okay,
probably maybe a specific conversation to have more one-on-one with your pharmacist because they're the ones that know all of the maybe the side effects and the black books of each medication.
okay. Um, you might not have a definitive answer for this one, but I often have severe cramps in my feet at night. What might be causing this?
I think that is something that we would have to maybe assess a bit more in details, and that's why we're maybe knowing with our medical history intakes forms when we have patients coming in with an assessment, but honestly, it gives us so much information. So, you know, what medications are you on? What is your medical history? Did you have surgeries? Did you have any traumas? You know, when did your symptoms start? So, you know, what is causing your pain? So,
Yeah, even simple things like nutrition. A lot
um,
of vitamins and minerals can actually give you muscle cramps. So there's a lot to unpack there. And yeah, just
mhm,
there's a lot of different things that can cause it. So it's really hard to give you a definitive answer what it might be without
yeah,
actually talking to you first.
yeah.
Okay. So we are at 11 o'clock, and I know you two have other appointments to get to. So I think we'll have to cut it off there.
Okay.
But I do want to remind anyone that didn't get their question answered that they can definitely write them to the email address they see on screen. The email will also be included in the follow-up email that all participants will receive. And so you can ask your questions to Sarab and Christine through that channel. And also, the email that you will receive will contain the recording for today's webinar if you want to watch it again or watch a part that you might have missed. And finally, we want to thank a big thank you to Sarab and Christine for coming on this morning and giving this really informative webinar. I hope that everyone learns something about foot health that they can apply. And remember that we do have other webinars coming up, so please check out our website at nafrottawa.com and you'll be able to see all our lineup of upcoming webinars. So thank you everyone for your participation today, and we hope to see you at our next webinar.
Yeah, thank you.
Thank you.
Bye bye everyone.
Bye.